Your life as an intern or as a resident can be a lot easier if you're just generally a nice guy. Nice to nurses, if you're nice to physical therapists, if you're nice to consultants, other residents. I think it'll make your life a lot easier. And since I'm going to be here for about 7 years, I have to be nice to everybody. You guys need a big, strong guy to replace your water?
We would love it.
We do.
I have to look at that. I don't even know.
So I actually encounter this quite commonly. We'll have patients who call in and need to have a procedure done, and usually it's the intern who takes care of it because we're on the floor. Mrs. Evans has developed a fluid collection in her lung, so she's having shortness of breath. So I looked at your chest x-ray, and you do have a pretty significant amount of fluid on your right lung. But I have to get permission from you to do the thoracentesis. That's what it's called. It's basically where we drain the fluid. Take deep breaths through your mouth. How are you doing in terms of pain?
Okay. Some fluid coming out?
Yeah, some fluid came out, so now we're going to take some more.
Okay.
I started to get some bubbles, meaning that there was some air in there. And then I got a little nervous because you're normally not supposed to see air.
Well, I can't take too much more of this.
We're just got to start basically from scratch.
I'm a little lost my confidence here. This isn't good.
Nothing to worry about. It's just that when I got the catheter in the first time, it bent a little. That's all that happened.
Well, okay, I'm a little worried. I mean, I'm worried that I had to do it twice.
I tried to thread the catheter in, and it got kinked. So then I couldn't put it through anymore. And now, as I'm trying to go in repeatedly, a couple of times, I just keep getting air. All right, Miss Evans, we're going to abort this procedure, and we need to get a chest x-ray to make sure you don't have a dropped lung. Okay?
And then what?
And we'll try to do this draining again.
I want somebody else in on there, too.
The fellow's coming.
I think there should have been 2 doctors in on this anyway. I mean, this is ridiculous. I'm sorry, I can't be too nice about it.
This is the first time that I've actually caused a complication directly myself, and it's the worst feeling in the world.
One more time, take a deep breath in. Hold your breath.
Better than our last exercise.
Yeah, it's improved, so I did something to make it better, but does she have a pneumothorax?
Yeah.
The cardiothoracic fellow was very good about telling me, look, you're gonna make this mistake over and over again. You made it once, you're gonna make it again. This is your first time, this is your initiation into surgery. You have a collapsed lung. We'll get the chest CT, we'll admit you to the hospital, and we'll have to put in a chest tube.
Well, I'm going to be anesthetized for that.
Absolutely. You have my 100% guarantee.
Okay,
Dr.
I'm not-
Fitton's going to be there with me.
Yeah.
And
I am not going to go through that any
so
more pain.
we'll get you
Is
under good
Dr. Fitt going to do it?
He's going to be there. Yeah.
I mean, not that I don't trust you, but I know
I understand.
You must understand how I feel.
I do.
I went in without a
100%.
collapsed lung and coming out with collapsed lung and fluid. I've got a double problem now.
I just want to let you know that I'm really sorry. And
I know
I mean,
you're
this is
sorry.
a complication that occurs, and I wish there was a way that we could not have it. The procedure itself caused a collapse. Yeah. Yeah. Okay. Let me, this is actually Tam calling me from her office, so I'll talk to her, okay?
He's busy apologizing to me. There's something went wrong here. I mean, I'm not stupid. I want a full-fledged doctor to do it now, not some resident. You're not going to accept that.